सो आज हम पढ़ेंगे स्केलेटन। बेसिक स्केलेटन से पहले आई थिंक 2-3 पेज मैंने ख़त्म कर दिया था। ठीक है, तो आज सिर्फ टेस्ट पढ़ेंगे। ओके, सो जनरल एनाटॉमी। ठीक है, जनरल एनाटॉमी भाई आपका कौन BD84 है। ठीक है, स्केलेटन पढ़ेंगे ना। मेरा जो पढ़ने का जो तरीका होता है, मैं पहले टेक्स्ट पढ़ता हूँ, बाद में इमेज पढ़ता हूँ। ठीक है, टेक्स्ट मतलब दिमाग में पूरा फिट बैठना चाहिए, उसके बाद मतलब हर एक चीज़, या फिर मर्ज करके भी पढ़ता हूँ, मतलब टेक्स्ट के साथ इमेज कैसा है, क्या है, इमेज का डिस्क्रिप्शन क्या है। ठीक है, ये मतलब काफ़ी तो लंबा है, ये हो गया। स्केलेटन बहुत एक बड़ा चैप्टर है, बहुत पेजेस इसमें है। आई थिंक 20-30 पेजेस होगा। सो कितना 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 आई थिंक 18 पेजेस। ठीक है, 18 तो बोथ साइड करेंगे तो 36 होगा। 37 मैंने ठीक बोला था। हाँ, दे दे दे। The skeleton include bone and cartilages. It forms the main bone and cartilages. ठीक है, it forms the main supporting framework of the body and is primarily designed for a more effective production of movement by the attached muscle. Now bones. Synonym: OS, Latin word, osteon, Greek word. Compare with the term osteology, ossification, osteomyelitis, osteomalacia, osteoma, osteotomy, etc. Definition and composition. Bone is 1/3 connective tissue. It is impregnated with calcium salt, which constitute the remaining 2/3 part. The inorganic calcium salt, mainly calcium phosphate, partly calcium carbonate, and traces of other salt, make it hard and rigid, which can afford resistance to compressive forces of weight bearing and impact forces of jumping. The organic connective tissue, that is collagen fiber, Make it tough and resilient मतलब flexible, which can afford resistance to tensile forces. In strength, bone is comparable to iron and steel. एक्जियल स्केलेटन, इसमें आपका स्कॉल, इसमें मेन स्कॉल आता है. सो एक्जियल स्केलेटन समझ नहीं, एक्जियल स्केलेटन ओके. स्कॉल, सो इसमें क्रानियम रे नंबर ऑफ बोन आसुची 8टा, फेस रे 14टा, हाइड रे गोटे, ऑडिटरी ऑसिकल 2टा ईयर रे, प्रति ईयर रे 3 मालियस इनकस स्टेप्स, सो 2टा ईयर रे 6टा हो जिवो. वर्टेब्रल कॉलम रे तमरो टोटली 26टा बोन रहउची. तापरे थोरैक्स, थोरैक्स थोरैक्स रे थोरैक्स पोर्शन आपका जो बनता है वो स्टेर्नम एंड रिब्स से होता है. स्टेर्नम आपके पास एक ही है, रिब्स आपके पास 24 है. अपेंडिकुलर स्केलेटन, ये पेक्टोरल, शोल्डर ग्रेडिल, इसमें क्लाविकुल, स्क्लैपुला आता है, ये दो होता है. अपर एक्सट्रीमिटीज में ह्यूमेरस आपके पास 2, ऑल्ना भी 2, रेडियस आपके पास 2, कार्पल 8 करके 16, मेटाकार्पल आपके पास 5 10, फालांजेस आपका 28. पेल्विक हिप ग्रेडल, पेल्विक और हिप बोन, लोअर एक्सट्रीमिटीज में फ्यूमर 2, फिबुला 2, टिबिया 2, पाटेला 2, टार्सल आपके पास 14 आएगा, मेटाटार्सल आपके पास 10 आएगा, फालांजेस 28, सो टोटल 206. द inorganic calcium salt is calcium hydroxy apatite, Ca10PO4 6OH2. It is removed by putting the bone in acid. It becomes flexible and can be tied as a knot. If organic tissue is removed by burning, the bone crumples into small pieces. Despite its hardness and high calcium content, the bone is very much a living tissue. It is highly vascular with a constant turnover of its calcium content. It shows a characteristic pattern of growth. It is subjected to disease and heals after a fracture. It has a greater regenerative power than any other tissue of the body except blood. It can mold itself according to changes in stress and strain it bears. It shows disuse, atrophy, and overuse hypertrophy. Okay, function. Bone gives shape and support to the body, resist any form of stress. These provide surface for attachment of a muscle, tendon, ligament. These serve as levers for muscular action. The skull, vertebral column, and thoracic cage protect brain, spinal cord, thoracic, and some abdominal viscera, respectively. Bone marrow manufacture blood cell. Bone marrow manufacture blood cell. Bone store 97% of the body calcium and phosphorus. Bone marrow contain reticuloendothelial cell which are phagocytic in nature and take part in immune response of the body. The larger paranasal air sinuses, example ethmoidal sinuses, affect the timbre of the voice. Classification of a bone according to shape. Long bone. Each long bone has a elongated shaft diaphysis and two expanded end, that is epiphysis, which are smooth and articular. The shaft typically has three surfaces separated by three borders, a central medullary cavity, and a nutrient foramen directed away from the growing end. Example, typical long bone. Typical long bone. These are humerus, radius, ulna, femur, tibia, fibula, with two secondary epiphyses. Miniature or short long bone have only one epiphysis like metacarpal, metatarsal, and phalanges. Modified long bone have medullary cavity in medial two-third part like clavicle. It transmit weight from the appendicular skeleton to axial skeleton. ठीक ଅଛି. Axial skeleton is colored. Short bone. So their shape is usually cuboid like a cube. ठीक है. और scaphoid मतलब boat shape. Example tarsal and carpal bone. These are pierced by blood vessel. Flat bone resemble shallow plates and form boundaries of certain body cavities. Example, bone in vault of the skull, sternum, ribs, and scapula. Irregular bone example हो गया hip bone and bone in the base of skull. Example है sphenoid and first and second cervical vertebra. Pneumatic bone. Certain irregular bone contain large air space lined by epithelium. एग्जाम्पल हो गया maxilla, sphenoid, ethmoid, etc. They make the skull light in weight, help in resonance of a voice, and act as air conditioning chamber for the inspired air. It improves the timbre मतलब quality of the voice. सेसामॉइड बोन 6 नंबर में these are bony nodules found embedded in the tendons or joint capsules. They have no periosteum and ossify after birth. They are related to the articular or non-articular bony surfaces, and the surface of contact are covered with hyaline cartilages and lubricated by a bursa or synovial membrane. Example, patella in the tendon of quadriceps femoris, figure 2.10. Pisiform in the tendon of flexor carpi ulnaris. Flabella in the tendon of lateral head of gastrocnemius. Rider's bone developed in tendon of adductor longus in professional riders. They do not have medullary cavity, Haversian system, or periosteum. Function of the sesamoid bone: to resist pressure, to minimize friction, to alter the direction of a pull of the muscle, to maintain the local circulation, protect the vessels and nerve. Accessory or supernumerary bones are not always present. These may occur as ununited epiphyses developed from extra center of ossification. Example, sutural bone of the skull, cervical ribs, lumbar ribs. The sutural or Ormian bone is mostly seen in the region of lambda. This can be present at Asterion and Terion as well. Such bone are common in hydrocephalic skull. In medico-legal practice, accessory bone may be mistaken for fracture. However, these are often bilateral and have smooth surface without any callus. B. Developmental classification. भगवान Developmental classification. Membrane or dermal bones ossify in membrane, that is intramembranous or mesenchymal ossification, and are thus derived from mesenchymal condensation. Example, bone of the vault of a skull like frontal, parietal, and facial bones like maxilla. Cartilaginous bone ossify in cartilages, intracartilaginous or endocartilaginous chondral ossification and are thus derived from replacement of preformed cartilaginous models. Example, bone of a limb like humerus, femur, vertebral column and thoracic cage. Membrano cartilaginous bones ossify parts in membrane and partly in cartilages. Example, clavicle, sternal end ossifies by endochondral ossification, while the rest of the bone ossifies by intramembranous ossification. Mandible, occipital, temporal, sphenoid. Somatic bone. Most of the bone are somatic visceral bone. These are a few and develop from pharyngeal arches. Example are hyoid bone, part of a mandible and ear ossicle. Then regional classification. Axial skeleton includes skull, vertebral column and thoracic cage. Appendicular skeleton include bone of the limb. Example, pectoral girdle, free upper limb and pelvic girdle, फ्री लोअर लिम्ब. ठीक है. देन उसके बाद रीजनल क्लासिफिकेशन के बाद अब आता है स्ट्रक्चरल क्लासिफिकेशन. Macroscopically, the architecture of a bone may be compact or cancellous. Figure 2.13. Compact bone is dense in texture like ivory but is extremely porous. It is best developed in the cortex of the long bone. This is an adaptation to bending and twisting forces, a combination of compression, tension and shear. Cancellous or spongy or trabecular bone is open in structure and is made up of a meshwork of trabeculae, that is rod and plates, between which are marrow containing spaces. The trabecular meshwork are of three primary types, namely meshwork of rod and plate, and meshwork of plates. Cancellous bone is an adaptation to compressive forces. Bones are marvelously constructed to combine strength, elasticity, and lightness in weight. Though the architecture of a bone may be modified by mechanical forces, the form of the bone is primarily determined by heredity. According to the Wolff's law, trajectory theory of Wolff's 1892, the bone formation is directly proportional to stress and strain. There are two forces, tensile forces and compressive force. Both the tensile and compressive force can stimulate bone formation under proper condition. The architecture of a cancellous bone is often interpreted in terms of the trajectorial theory. Thus, the arrangement of a bony trabeculae, that is lamella, is governed by the line of a maximal internal stress in the bone. Pressure lamella are arranged parallel to the line of a weight transmission, whereas tension lamella are arranged at right angle to pressure lamella. The compact arrangement of a pressure lamella forms bony buttress for additional support like calcar femoral. Microscopically, the bone is of a five type, namely lamellar, including both compact and cancellous, uvein, fibrous, dentine, and cement. Lamellar bone. Most of the mature human bones, whether compact or cancellous, are composed of thin plates of bony tissue called as lamellae. These are arranged as branching curved plates in the cancellous bone, but in concentric cylinder, that is Herbacean system or secondary osteon, in a compact bone. Uvein bones seen in fetal bone fracture repairs and in cancer of a bone. The collagen fiber and bone crystal are arranged randomly. Fibrous bone. Fibrous bone is found in young fetal bone but are common in reptile and amphibia. Dentine and उसके बाद cement. Dentine and cement occur in teeth. Gross structure of an adult long bone. Gross structure of an adult long bone. ये कहाँ तक खत्म होता है? बाप रे 82. अभी मैं कहाँ पर हूँ? 60. सलाहुरी कितने पेज है? Gross structure of an adult long bone. Naked eye examination of the longitudinal and transverse section of a long bone shows the following feature. Number 1, shaft forms without inward and is composed of a periosteum, cortex and medullary cavity. Periosteum is a thick fibrous membrane covering the external surface of the bone. It is made up of an outer fibrous layer and inner cellular layer which is osteogenic in nature. Periosteum is united to the underlying bone by Serpe fibers, and the union is particularly strong over the attachment of a tendon and ligaments. At the articular margin, the periosteum is continuous with the capsules of the joint. The abundant periosteal arteries nourish the outer part of the underlying cortex also. Periosteum has a rich nerve supply which make it most sensitive part of the bone. It is absent in sesamoid bone. Function of periosteum are osteogenic, bone growth, bone repair, and protective. Cortex is made up of compact bone which gives it the desired strength to withstand all possible mechanical strains. Medullary cavity. Medullary cavity is lined by endosteum. The osteoblast in endosteum helps in bone repair and remodeling of bones. The medullary cavity is filled with red or yellow bone marrow. At birth, the marrow is red everywhere with the widespread active hemopoiesis. As the age advances, the red marrow at many places atrophies and is replaced by yellow fatty marrow which stores calories and with no power of hemopoiesis. Red marrow persists in the cancellous end of the long bone, sternum, ribs, iliac crest, vertebral, and skull bones throughout the life. The site of bone marrow in adult are shown in figure 2.17. उसके बाद the two end of a long bone are made up of cancellous bone covered with a hyaline मतलब articular cartilages. Competency achievement. The student should be able to describe parts, blood and nerve supply of a long bone. भगवान. So parts of a young growing bone. There are four parts of a young bone: epiphysis, diaphysis, metaphysis, epiphyseal plates. A typical long bone ossifies in three parts. The two end from secondary center मतलब ossification center appearing after birth, and the interviewing shaft from a primary center, that is ossification center, appearing before birth. Before the ossification is complete, the following part of the bone can be defined. Epiphysis. The end and tip of a bone which ossifies from secondary center are called as epiphyses. These are classified as according to the number of epiphyses. Simple. Ends of a long bone develops from many epiphyses. These fuse independently with shaft. Example हो गया femur. So simple. End of a long bone develop from many epiphyses. Okay. These fuse independently with the shaft. Example हो गया femur. Compound. The end of a bone develops from many center which unite to form a single epiphysis. The single epiphysis fuses with the shaft. Example humerus. Based on function. Pressure epiphysis. Pressure epiphysis. It is articular and takes part in transmission of the weight. Example head of humerus, lower end of radius, etc. Then traction epiphysis. It is non-articular and does not take part in the transmission of a weight. It always provides attachment to one or more tendon which exert a traction on the epiphysis. The traction epiphysis ossify later than the pressure epiphysis. Example trochanter of a femur and tubercle of a humerus. atavistic epiphysis. It is phylogenetically an independent bone which in human becomes fused to another bone. Example, coracoid process of a scapula and ostrigonum ostrigonum or lateral tubercle of a posterior process of a talus. फिगर 2.19b. ओके बाद में aberrant epiphysis. Aberrant, it is not always present. Example, epiphysis at the head of the first metacarpal and at the base of other metacarpal bone. Compound epiphysis, in some bones 2 to 3 smaller epiphyses joined to form compound epiphysis. Before these join the shaft. Example, at upper end of a humerus, epiphysis of the head, greater and lesser tubercle join to form a compound epiphysis. Then this compound epiphysis join the shaft. Similar event occur at the lower end of the humerus also. Diaphysis, it is a elongated shaft of a long bone which ossifies from a primary center of ossification. It receives blood supply from the nutrient artery. Metaphysis, the epiphyseal end of a diaphysis are called metaphysis. Each metaphysis is the zone of active growth. Before epiphyseal fusion, the metaphysis is richly supplied with blood through end arteries, forming hairpin bends. 4. Thus, metaphysis is the common site of osteomyelitis in children because the bacteria or emboli are easily trapped in the hairpin bends, causing infarction. After the epiphyseal fusion, vascular communication are established between the metaphyseal and epiphyseal arteries. Now the metaphysis contains no more end arteries and is no longer subjected to osteomyelitis. Metaphysis may be intracapsular, example both end of the humerus. सेकेंड हो गया एक्स्ट्रा कैप्सुलर, एग्जाम्पल अपर एंड लोअर एंड ऑफ रेडियस एंड टिबिया. epiphyseal plate of cartilages. Epiphyseal plate of cartilages. Epiphyseal plate separate epiphysis from metaphysis. Proliferation of cell in this cartilaginous plate is responsible for lengthwise growth of a long bone. After the epiphyseal fusion, the bone can no longer grow in length. The grow cartilage is nourished by both the epiphyseal and metaphyseal arteries. Blood supply of a bone. Arterial supply. Young long bone. The arterial supply of a long bone is derived from the following sources. Nutrient artery. It enters the shaft through the nutrient foramen, runs through the cortex and divide into ascending and descending branches which turn down to form hairpin bends. Each branch divide into a number of small parallel channels which terminate in adults metaphysis by anastomosing with the epiphyseal, metaphyseal, and periosteal arteries. The nutrient artery supplies medullary cavity, inner two-thirds of the cortex and metaphysis. The growing end of the bone in upper limb are upper end of humerus and lower end of radius and ulna. In lower limb, the lower end of femur and upper end of tibula are the growing ends. The nutrient foramen is directed away from the growing end of the bone. Their direction are indicated by a jingle. To the elbow I go, from the knee I flee. Infection in blood produces small emboli. These may block the nutrient artery at the site of a hairpin bend, resulting in osteomyelitis, then periosteal arteries. These are especially numerous beneath the muscular and ligamentous attachment. They ramify beneath the periosteum and enters the Volkmann's canal to supply the outer one third of the cortex. Then epiphyseal arteries. Jai Shri Ram. These are derived from periatricular vascular arcades, that is circulus vasculosus, found on the non-articular bony surface. Out of the numerous vascular foramina in this region, only a few admits the arteries, epiphyseal and metaphyseal, and the rest are venous exit. The number and size of these foramina may give an idea of the relative vascularity of two ends of a long bone. Metaphyseal arteries. These are derived from the neighboring systemic vessels. They pass directly into the metaphysis and reinforce the metaphyseal branches from the primary nutrient artery. In miniature long bone metacarpals, the infection begins in the middle of the shaft rather than at the metaphysis because the nutrient artery breaks up into a plexus immediately upon reaching the medullary cavity. In the adults, however, the chances of infection are minimized because the nutrient artery is mostly replaced by the periosteal vessels. Long short bone. Long short bone. Nutrients artery enter the middle of a shaft and divides to form a plexus. Periosteal artery supplies major part of a bone and may replace the nutrient artery. Short bones. Short bone are supplied by numerous periosteal vessels which enter their non-articular surface, vertebra. In a vertebra, the body is supplied by anterior and posterior vessels and the vertebral arc by large vessel entering the base of a transverse process. Its red marrow is drained by two large basivertebral veins. These foramina lie on the posterior aspect of the body of the vertebra. ribs. A rib is supplied by a nutrient artery which enter it just beyond the tubercle. The periosteal arteries. Venous drainage. Veins are numerous and large in cancellous red marrow containing bones, that is basivertebral vertebral vein. In the compact bone, they accompany arteries in the Volkmann canal. Lymphatic drainage. Lymphatics have not been demonstrated within the bone, although some of them do accompany the periosteal blood vessel which drain to the regional lymph nodes. Nerve supply of the bone. भाई आहुरी केते एटा बहुत बड़ चैप्टर आटाको थरे बोधे पढ़ी सारी बोधे मुझे जो भी है. Nerve supply of bone. Nerve accompany the blood vessel. Most of them are sympathetic and vasomotor in function. A few of them are sensory, which are distributed to the articular end and periosteum of the long bone, to the vertebra, and to large flat bone. Competency achievement. The student should be able to enumerate laws of ossification. Okay. Development and ossification of bones. Bones are first laid down at mesodermal connective tissue. Condensation, replacement of mesodermal models into bone, is called intramembranous or mesenchymal ossification, and the bones are called membrane or dermal bones. However, mesodermal stage may pass through cartilaginous state by chondrification during second month of intrauterine life. Replacement of a cartilaginous model into bone is called intracartilaginous or endochondral ossification, and such bones are called cartilaginous bones. Ossification takes place by the center of ossification, each one of which is a point where laying down of lamella मतलब bone formation starts by the osteoblast situated on the newly formed capillary loops. The center of ossification may be primary and or secondary. The primary center appear before birth, usually during 8 weeks of intrauterine life. The second center appear after birth during childhood, with a few exception of lower end of femur and upper end of tibia, which appear during the 9th month of intrauterine life. Many secondary centers appear during puberty. A primary center forms diaphysis and the secondary center form epiphysis. Fusion of epiphysis with the diaphysis starts at puberty and is completed by the age of 25 years, after which no more bone growth can take place. The law of ossification states that secondary center of ossification which appear first are last to unite. Exception is lower end of tubula, the end of a long bone where epiphyseal fusion occurs later is called the growing end of the bone. Then growth of a long bone. Bone growth is a lengthy by multiplication of a cell in the epiphyseal plate of the cartilages. Bone grows in thickness by multiplication of a cell in the deeper layer of a periosteum. Bone grows by deposition of a new bone on the surface and at the end. This process of a bone deposition by osteoblast is called appositional growth, appositional oppo, appositional growth, or surface accretion. However, in order to maintain the shape, the unwanted bone must be removed. This process of a bone removal by the osteoclast is called remodeling. This is how marrow cavity increases in size, factor affecting growth. हे भगवान, कितना बड़ा चैप्टर है वे, बहुत बड़ा चैप्टर है। पढ़ रहा हूँ ना, साला सर नहीं रहा है। फैक्टर अफेक्टिंग ग्रोथ। Adequate amount of protein, carbohydrate, mineral, vitamin and hormone are necessary for proper growth of bone. Vitamins. Vitamin A control the activity, coordination and distribution of osteoblast and osteoclast. Lack of vitamin A decreases the activity of osteoclast, leading to reduction in size of cranial and spinal foramina. Vitamin D is necessary for the absorption of calcium and phosphorus from intestine, which help in proper ossification. Vitamin C is necessary for maintenance of organic matrix. सेकेंड आता है फैक्टर अफेक्टिंग ग्रोथ में हार्मोनल फैक्टर। adequate amount of growth hormone of anterior pituitary, that is hypophysis cerebri. सेकेंड हो गया पाराथॉर्मोन ऑफ parathyroid gland, calcitonin of thyroid gland are also necessary. Then molecular regulation of bone formation. Members of a transforming growth factor beta family of genes are involved in various stages of bone formation. Medico-legal and anthropological aspect. When a skeleton or isolated bone are received for a medico-legal examination, one should be able to determine whether the bone are human or not, whether they belong to one or more person, the age of individual, the sex, the stature, the time and cause of death. Estimation of a skeletal age. Up to the age of 25 years, the skeletal age can be estimated to within 1 to 2 years of a correct age by the state of a dentition, by the stage of a dentition and ossification, provided the whole skeleton is available. From 25 years onward, the skeletal age can be estimated to within plus or minus 5 years of the correct age by the state of a cranial suture and of the bony surface of the symphysis pubis, symphysis pubis. In general, the appearance of a secondary center and a fusion of epiphysis occurs about 1 year earlier in female than in males. These events are also believed to occur 1 to 2 years or 2 to 3 years earlier in India than in Western countries. However, Jeet and Singh 1971 did not find any difference between the Eastern and Western races. Estimation of sex. Gender can be determined after the age of puberty. Gender differences are best marked in the pelvis and skull, and accurate determination of a gender can be done in over 90 percentage cases with either pelvis or skull alone. However, gender sexual dimorphism has been worked out in a number of other bones like sternum, atlas, and most of the limb bones. Estimation of stature, height. It is a common experience that trunk and limbs show characteristic ratios among themselves and in comparison with total height. Thus, number of regression formulas have been worked out to determine height from the length of individual limb bone. Siddiqui and Shah 1944, Singh and Sohal 1952, Jeet and Singh 1956, Athwale 1963, Kolte and Bansal 1974, Kate and Majumdar 1976. Height can also be determined from the parts of a certain long bone, from hand length, and from foot measurement. Crown rump length has been correlated with diaphyseal length of fetal bones and with the neonatal and placental parameter estimation race. It is of interest to anthropologists. A number of metrical like cranial and facial indices and non-metrical features of the skull, pelvis, and certain other bones are of racial significance. Cartilage synonym: chondros, Greek word, and gristle. Compare with the terms chondrification, chondrodystrophy, synco, synchondrosis, synchondrosis, etc. Definition: cartilage is a connective tissue composed of a cell, that is chondrocyte, and a fiber, that is collagen or yellow elastic, embedded in a firm gel-like matrix which is rich in mucopolysaccharide. It is much more elastic than bone. General feature: cartilage has no blood vessel or lymphatics. The nutrition of a cell diffuses through the matrix. Cartilage has no nerve. It is therefore insensitive. Cartilage is surrounded by a fibrous membrane called perichondrium, which is similar to periosteum in structure and function. The articular cartilages has no perichondrium, so that its regeneration after injury is inadequate. When cartilage calcifies, the chondrocyte die and the cartilage is replaced by bone-like tissue. Table 2.2 shows the comparison between bone and cartilages. Bone is hard, cartilage is firm. Matrix has inflexible material called osin. Cartilage it has chondroitin प्रोवाइडिंग फ्लेक्सिबल। मैट्रिक्स पोजेसेस कैल्शियम सॉल्ट, जबकि कार्टिलेज में होता है कैल्शियम सॉल्ट आर नॉट प्रेजेंट। बोन has rich nerve supply, it is vascular in nature, it does not have nerve supply, it is avascular in nature. Bone marrow is present, एतरे bone marrow absent. Growth is only by apposition by surface deposition, जबकि growth is both appositional and interstitial from within. Interstitial माने from within. Types of cartilages. There are 3 type of cartilages: hyaline cartilages, fibrocartilages, elastic cartilages. Table 2.3 reveals the comparison among the 3 type of cartilages. I think मैंने ये कभी पढ़ा था. Comparison of 3 type of cartilages: hyaline cartilages, fibrocartilages, इलास्टिक कार्टिलेजेस. 3 टाइप का कार्टिलेजेस हमारे पास होता है. देयर आर 3 टाइप ऑफ कार्टिलेजेस: हाइलिन कार्टिलेजेस, फाइब्रो कार्टिलेजेस, इलास्टिक कार्टिलेजेस. ठीक है. लोकेशन, हाइलिन कार्टिलेजेस कहाँ पर होता है? इन द आर्टिकुलर कार्टिलेजेस ऑफ लॉन्ग बोन, एपिफाइजियल प्लेट, नाजल कार्टिलेजेस, थायराइड, क्रिकॉइड, मोस्ट ऑफ द एरिटेनॉइड, ट्रैकिया, ब्रोंकाई, कोस्टल कार्टिलेजेस. तो यहाँ पर हमें हाइलिन कार्टिलेजेस देखने को मिलेगा. फाइब्रो कार्टिलेजेस इन द इनवर्टिब्रल डिस्क, इंटरप्यूबिक डिस्क ऑफ सिम्फाइसिस pubis, articular disc of temporomandibular joint, sternoclavicular joint and inferior radio-ulnar joint. Articular cartilages of TMG मतलब temporomandibular joint एंड स्टेर्नोक्लाविकुलर जॉइंट. तो यहाँ पर हमें फाइब्रो कार्टिलेजेस देखने को मिलेगा. देन इलास्टिक कार्टिलेजेस इन द पिना, एक्सटर्नल ऑडिटरी मीटस, यूस्टेचियन ट्यूब, एपिग्लॉटिस, vocal process of arytenoid cartilages, corniculate and क्यूनिफॉर्म कार्टिलेजेस. तो यहाँ पर हमें इलास्टिक कार्टिलेजेस देखने को मिलेगा. नाउ इसका कलर क्या होता है? हाइलिन कार्टिलेजेस आपका ब्लूइश वाइट कलर होता है. फाइब्रो कार्टिलेजेस ग्लिस्टनिंग वाइट होता है, जबकि इलास्टिक कार्टिलेजेस येलो इस टाइप का होता है. अपीयरेंस देखने को कैसे मिलेगा? हाइलिन कार्टिलेजेस जो होता है वो शाइनी और ट्रांसलूसेंट अपीयरेंस होता है. फाइब्रो कार्टिलेजेस ओपैक होता है. इलास्टिक कार्टिलेजेस ओपैक होता है. देन फाइबर क्या क्या इसमें प्रेजेंट होता है? हाइलिन कार्टिलेजेस में वेरी थिन, हैविंग सेम रिफ्रैक्टिव इंडेक्स एज मैट्रिक्स, सो दीज आर नॉट सीन. जबकि फाइब्रो कार्टिलेजेस में न्यूमेरस व्हाइट फाइबर आर प्रेजेंट. इलास्टिक कार्टिलेजेस में न्यूमेरस येलो फाइबर आर प्रेजेंट, क्योंकि इसका कलर भी येलो होता है. इलास्टिसिटी कैसा होता है? हाइलिन कार्टिलेजेस आपका फ्लेक्सिबल होता है. फाइब्रो कार्टिलेजेस मोर फर्म स्ट्रॉन्गेस्ट होता है एंड इलास्टिक कार्टिलेजेस मोस्ट फ्लेक्सिबल होता है. देन पेरिकॉन्ड्रियम क्या क्या होता है? हाइलिन कार्टिलेजेस में पेरिकॉन्ड्रियम प्रेजेंट होता है. फाइब्रो कार्टिलेजेस में एब्सेंट होता है एंड इलास्टिक कार्टिलेजेस में पेरिकॉन्ड्रियम आपका प्रेजेंट होता है. सेल्स, हाइलिन कार्टिलेजेस में मैक्सिमम सेल आपको देखने को मिलेगा। फाइब्रो कार्टिलेजेस में मिनिमम स्क्वीज्ड बिटवीन फाइबर में देखने को मिलेगा। इलास्टिक कार्टिलेजेस में मॉडरेट आपका देखने को मिलेगा। ठीक। देन क्लिनिकल एनाटॉमी ऑफ स्केलेटन, ए डिफेक्ट इन मेम्ब्रेनस ओसिफिकेशन कॉजेस ए रेयर सिंड्रोम कॉल्ड A defect in membranous ossification causes a rare syndrome called cleidocranial dysostosis. It is characterized by three cardinal features: varying degree of aplasia of the clavicle, increase in transverse diameter of cranium, retardation in uh, fontanelle ossification. It may be hereditary or environmental in origin. A defect in endochondral ossification causes a common type of dwarfism called as achondroplasia. Achondroplasia, in which the limbs are short but the trunk is normal. It is transmitted by Mendelian dominant character. Periosteum is particularly sensitive to tearing or tension. Drilling into the compact bone without anesthesia causes only mild pain or an itching sensation. Drilling into the spongy bone is much more painful. Fractures, tumors, and infection of the bone are very painful, as periosteum is richly supplied by somatic nerve. Blood supply of the bone is so rich that it is very difficult to interrupt it sufficiently to kill the bone. Passing a metal pin into the medullary cavity hardly interferes with the blood supply of the bone. Fracture is a break in the continuity of a bone. The fracture which is not connected with the skin wound is known as simple मतलब closed fracture. The fracture line may be spiral or horizontal or oblique. The fracture which communicates with the skin wounds is known as compound or open fracture. A fracture requires reduction by which the alignment of the broken ends is restored. Healing मतलब repairs of a fracture takes place in three stages: repair by granulation tissue, union by callus, consolidation by mature bone. बापरे. Hanging leads to fracture of a dens of a axis vertebra. ओके ये भाई सलाहुरी कितने अच्छी हुई. Axis or second cervical vertebra may gets fractured in dens of a axis gets separated from the body as in hanging. It hits the vital center in the medulla oblongata, causing instantaneous death. Even fracture of a lamina may cause death. In rickets, deficiency of a vitamin D, calcification of a cartilages fails, and ossification of the growth zone is disturbed. Rickets affects the growing bones, and therefore the disease develops during the period of most rapid growth of a skeleton, that is 3 months to 3 years. Osteoid tissue is formed normally and the cartilaginous cell proliferate freely, but mineralization does not take place. This results in craniotapes, rachitic rosary at the costochondral junction, Harrison sulcus at the diaphragmatic attachment, enlarged epiphyses in limbs bone, and the spinal and pelvic deformities. For proper development of a bone, a child requires adequate amount of protein, calcium, vitamin D, etc. Deficiency of calcium and vitamin D in growing children leads to widening of end of a bone with inadequate ossification. This condition is called rickets. In scurvy, deficiency of vitamin C, formation of collagenous fiber and matrix is impaired. Defective formation of the intercellular cementing substances and lack of collagen cause rupture of capillaries and defective formation of new capillaries. Hematoma in the muscles and bones subperiosteal cause severe pain and tenderness. The normal architecture at the growing end of the bone is lost. Many skeletal defects are caused by genetic factor or by a combination of a genetic, hormonal, nutritional factor. The vertebra arc or laminae of the vertebral column are mostly normal. The spinal cord may be covered just by skin, that is spina bifida occulta. occulta. There may be protrusion of the meninges surrounding the spinal cord placed in the vertebral canal, that is meningocele. There may be protrusion of the spinal cord as well as meninges, that is meningomyelocele. If deficiency of calcium and vitamin D occurs in adult life, it leads to osteomalacia. The bones on X-ray examination reveals thick, unclassified, calcified osteoids. Osteoporosis shown thin and small trabeculae. Table 2.4 shows the comparison between osteoporosis and osteomalacia. Deficiency of calcium in bones in old age leads to osteoporosis, seen both in female and males. Due to osteoporosis, there is forward bending of the vertebral column leading to kyphosis. Kyphosis पता नहीं इसका प्रोनाउंसिएशन क्या है. Nerves are closely related to bones in some areas. Fracture of a bone of those area may lead to injury to the nerve. Nerves are closely related to the bones in some areas. The fracture of a bone of those area may lead to injury to the nerve, leading to paralysis of a muscle supplied, including the sensory loss. Sensory loss हो जाएगा. Okay. Then comparison of osteoporosis and osteomalacia. Calcium and phosphatase, alkaline phosphatase, osteoblast trabeculae. तो ओस्टियोपोरोसिस रे कैल्शियम एंड फॉस्फेट आपका नॉर्मल होता है, जबकि ओस्टियोमेलासिया में ये लो भी हो जाता है कैल्शियम एंड फॉस्फेट. अल्कालाइन फॉस्फेटेज कैसा होता है, ओस्टियोपोरोसिस में नॉर्मल होता है, बट ओस्टियोमेलासिया के केस में ये रेज्ड होता है अल्कालाइन फॉस्फेटेज. ओस्टियोब्लास्ट ओस्टियोपोरोसिस में नॉर्मल होता है, जबकि ओस्टियोमेलासिया में इंक्रीज्ड होता है. ट्राबिकुले जो होता है ओस्टियोपोरोसिस में थीन एंड स्मॉल होता है, ओस्टियोमेलासिया में थिक एंड ऑन कैल्सिफाइड ओस्टियड होता है. नॉर्मल स्पाइन. ओके. काइफोटिक स्पाइन बेंड होता है. बस ये 2 पेज रह गए. फेलियर ऑफ ओसिफिकेशन इन द सेसामॉइड बोन इज मिस्टेकन फॉर फ्रैक्चर ऑफ अ बोन. एग्जाम्पल पाटेला. इफ इन्फेक्शन रिचेस द intracapsular metaphysis, it may result in septic arthritis. Bone marrow biopsy. Bone marrow can be taken either from manubrium, sterni, or iliac crest in various clinical conditions. Bone tumor. Benign or malignant tumor can occur in the bone. Rupture of the cartilages. The medial meniscus of knee joint is mostly affected. It is treated by replacement. Tumor of cartilages. The tumor may be benign or malignant. These are called chondromas and chondrosarcomas respectively. Cartilage transplantation. Cartilages can be transplanted from one person to another. The matrix of a cartilage prevent the entry of a antigen. Now points to remember. Inorganic calcium salt as calcium hydroxyapatite CF10 PO4 6OH2 is present in the bone. Femur is the longest and strongest bone. Steps of the middle ear is the shortest bone. 3 bony ossicles of a middle ear are fully developed at birth. Hyoid bone mandible and 3 bony ossicles of a middle ear develop from brachial cartilages. Hyoid bone does not articulate with any other bone. Fibula does not follow the law of ossification. Clavicle is a long horizontally placed bone. Periosteum does not cover the sesamoid bone and the 3 bony ossicles of the middle ear. Most common site of osteomyelitis is the metaphysis region of the long bone. Bone marrow puncture is done in iliac crest in children and manubrium sterni in adult. Bone fracture are seen more often in person with adequate protein, calcium and vitamin D. External ear or pinna is made of elastic cartilages. Its size does not increase even if it is pulled as part of a punishment. Elastic cartilages is present in epiglottis and vocal process of arytenoid cartilages. This cartilages does not calcify, ossify. Fibrocartilages give strength to site of its presence. It is chiefly present in middle joint. Hyaline cartilages is maximum in the body. All the somatic bones initially were composed of hyaline cartilages. Intramembranous ossification is quicker one-step process compared to intracartilaginous two-step process. Bones of the cranium vault are ossified by intramembranous ossification to quickly protect the developing brain. Now multiple choice question. आठटा अच्छी फटाफट कर दो. What percentage of calcium of the body is stored in the bone? 97%. C have a correct answer. Proportion of inorganic matter to organic matter in the bone is 3:1. Proportion of inorganic matter to organic matter in the bones 3:1. The cartilaginous model of a bone arises from the cartilaginous model of a bone B. Yes, mesoderm. Length of a bone increases by multiplication of a cell at epiphyseal plate. Ossification of a long bone begins in intrauterine life at ossification of a long bone begins in intrauterine life at 8 week. Which cartilage has no perichondrium? को cartilage रे perichondrium नथाए. Yes, white fiber. The first bone to start ossifying is no, clavicle. Which one is not a traction epiphysis? Which one is not a traction epiphysis? एमानक भितरु कोटा traction epiphysis नुहे. टासिबनी. Head of humerus. सो स्केलेटन चैप्टर खत्म. आई थिंक मैंने पहले भी इसको पढ़ा था. ठीक है, कोई बात नहीं, लेकिन अगर आज पढ़ा है ठीक से याद नहीं रहता है. सो इंट्रोडक्शन, जनरल एनाटॉमी का इंट्रोडक्शन एक बार खत्म किया. स्केलेटन आई थिंक 2 बार, लेकिन मुझे याद नहीं आ रहा है. चलो कोई बात नहीं, अगर आज कंप्लीट तो खत्म कर दिया. स्केलेटन चैप्टर रीडिंग हो गया. ये कम से कम हर एक चैप्टर को 3 बार रिवीजन मतलब मानना चाहिए. फिर उसके बाद उसका नोट होता है, बहुत सारे चीज़ होता है. ठीक है, सो स्टडी विथ मी ब्लॉग्स में आज के लिए इतना ही. फिर मिलते हैं किसी और एक स्टडी विथ मी ब्लॉग्स के साथ. तब तक के लिए जय हिंद, वंदे मातरम. थैंक्स फॉर वॉचिंग.